Thanks for joining RxGeneIQ short patient scenario regarding antidepressant selection and optimization using pharmacogenomics. Many referrals for PGx testing are related to antidepressant intolerance or therapy failure. A good trial for a new antidepressant is about 6 weeks to show effectiveness or lack of. It certainly is difficult for providers and patients to go through multiple trial and errors to find the right antidepressant at the right dose. Therefore, PGx results can be very helpful to guide therapy in this area. There are two major metabolic pathways with more robust clinical recommendations, namely CYP2D6 and CYP2C19. Other areas of interest that currently lack strong evidence are COMT and MTHFR. Let's introduce the patient scenario to demonstrate how we can optimize antidepressant therapy using PGx test result. Here's our 53-year-old female patient that is referred to RxGeneIQ for PGx testing and consultation to guide antidepressant therapy selection and optimization. Patient has a past medical history of intolerance and therapy failure to various antidepressants. The Duloxetine failed and it was not effective at the lower doses. Patient is not willing or able to try higher doses because she's afraid of multiple side effects, such as the headache that she experienced with the lower dosing. Venlafaxine gave her elevated blood pressure, and this is a side effect of venlafaxine that is known to be. So as per what we see, we didn't think that would be a good choice for her. Fluoxetine gave her insomnia, nausea, and paroxetine gave her dry mouth. In this case, I am sharing my favorite table with the citation, with online citation down here with you. This is a quick guide of where many of our antidepressants are fitting into this table under specific genomic pathway. For example, citalopram, Lexapro, and Zoloft sit under the CYP2C19 here. These other three antidepressants sit here. And then as you see, this area is rather complicated as one or each of these antidepressants belong to multiple pathways. For our patient, the genomic test results showed that the patient was CYP2D6 poor metabolizer and CYP2C19 normal metabolizer. Remember that these two pathways are the major pathways for antidepressant metabolism. So if one pathway is a poor metabolizer, it should be avoided because, as you see, the patient is getting a lot of side effect from metabolizing those medications that belong to this pathway. Pathway 2D6 has fluoxetine and paroxetine belong to this pathway. So if you look at this up here, paroxetine and fluoxetine are both giving her side effects, and so they should be avoided. She's a poor metabolizer, cannot get rid of these medications, and therefore she's getting a higher concentration of this medication and therefore higher risk of side effect. Going to the other major pathway, that is the CYP2C19. She's a normal metabolizer here. So it does make sense to pick an antidepressant that belongs to this pathway. 2C19 has 3 antidepressants here, so all these 3 are fair choices to pick for this patient. If the patient has any history of QT prolongation, or then we would stay away from Lexapro or citalopram, as these two have dose-related QT prolongation as a side effect. So in that case, we do Zoloft. We did end up recommending Zoloft to this patient. We hope this patient case was useful to you. At RxGeneIQ, we value our collaboration with providers and their referrals. If interested, please feel free to view other patient scenarios or sign up to be on our mail list for future patient cases.